Dr. Sukhbir Singh live from Delhi. Dr. Sukhbir is a board certified and trained plastic surgeon specializing in cosmetic surgery and aesthetic medicine with over 10 years of experience. Today, Dr. Sukhbir Singh will speak on this very topic, beautiful spotless skin and rising alarm for misuse of topical steroids. Welcome, Dr. Singh.
Thank you so much for the kind introduction.
To start with, why are we not supposed to use any cream or formulation containing topical steroids?
So, unfortunately, in our country, though the laws are very, very clear that steroids should not be available over the prescription, without prescription to anyone. That means they should not be available OTC. And so people don't know that over prolonged usage, you are actually harming your skin.
Which are the common side effects observed due to misuse of steroids?
Okay, so as I said, very commonly, pigmentation is the most common which I routinely see. That is one thing, because people will come and say that, doc, we had pigmentation, we went to a chemist, we took a cream, we applied it initially, it showed a very good result, we had a good whitening, and then we continued using it and it became worse. So that is first thing, foremost. Secondly, because of the chronic use, you can have atrophy of the skin, which is called super thinning or papery thin skin, which I told you about. The problem with that skin is that it is highly susceptible to any form of injury.
What are the common examples of topical steroid misuses?
So we have a lot of less potent and potent steroids being used, like we have mometasone and we have other stronger steroids which are being, like hydrocortisone. It is a less potent steroid. So there are a lot of combinations which are cream. Like I'll tell you something like we have combination of mometasone with fusidic acid. Creams are available. So if you can, so I'll tell you that whenever you go to a counter, if your doctor has prescribed you this combination, obviously he would have thought about it and prescribed you. But if you go to a counter and he's given you some multiple combination cream, definitely check out if there is a steroid in that. Or
do topical steroids weaken my immune system? Can they weaken my immune system?
So obviously topical steroids per se cannot weaken your immune system. Yes, if they are used along with oral steroids, then yes, they can weaken your immune system. But saying that topical steroids weaken your immunity of that particular portion of the skin where you're using the steroid. So suppose you're using something for your hand or something for your face. So that particular area is highly susceptible to a lot of injuries, external injuries, like sunlight, like secondary infections and other problems. So that way, that local area, local immune system may go.
What happens if you are using topical steroids too much?
Obviously, I think we have addressed that point before, but we'll still talk about it, that it can lead to acne, it can lead to thinning or atrophy of the skin, papery white skin. It can lead to damage of the skin barrier. It can cause secondary infections, pigmentation, rashes, and so on and so forth.
What happens if you put steroid cream on a fungal infection?
First of all, it worsens the fungal infection. Okay, first thing. Secondly, the diagnosis of fungal infection goes off and cannot be really made out if you have actually used steroid creams for more than 3 weeks. So please do not just apply steroid creams over any itch area.
Like, subscribe, and press the bell icon. Thanks for watching.
To know more on beautiful spotless skin and rising alarm for misuse of topical steroids, watch the full talk show with Dr. Sukhbir Singh from Delhi on Beautiful Spotless Skin Facebook page.